Hello everyone, and welcome to the Crisis Prevention and Intervention Plan training. This training is based from the North Carolina Department of Health and Human Service Division of Mental Health, Developmental Disabilities, and Substance Abuse Service Bulletin 139. Person-centered thinking and planning is a fundamental part of implementing North Carolina's service array for people receiving mental health, intellectual developmental disabilities, and substance abuse services. The Standardized Crisis Plan, which is a component of the Person-Centered Plan, was implemented in April of 2006. Based on significant stakeholder feedback, a strong focus on decreasing the number of individuals presenting to and remaining in emergency departments, and the need to take more comprehensive approach with the emphasis on promotion, prevention, treatment, rehabilitation, care, and recovery, the Person-Centered Crisis Plan has been revised. The Crisis Plan will remain a required part of the Person-Centered Plan. However, effective October 1st, 2013, the Person-Centered Plan will include a more comprehensive crisis plan. To allow for more effective and efficient transition, the plan must be fully implemented by January 1st, 2014. However, providers may use the comprehensive plan as soon as October 1st, 2013. The revised comprehensive plan will be required for individuals who meet the criteria defined as being at higher risk. All other individuals that receive enhanced services are to continue to have the current one-page person-centered crisis plan developed. To be able to understand this change, we first need to know what a crisis plan is. A crisis plan is a document designed to provide all the information necessary to support and give direction to help prevent a crisis from occurring. It also helps us learn how to respond effectively when the crisis does occur, and it also helps us plan for the successful resolution. Now that we know what it is, we may be asking ourselves, well, who should receive a crisis plan? Well, the one-page crisis plan is required for individuals who receive enhanced services and are not deemed to be higher risk. However, the person-centered comprehensive crisis plan will be required for individuals who meet the criteria defined as being higher risk for a crisis incident, such as the following. Now that you know the qualifications of what are high risk, now we're going to dive back into the crisis plan more specifically. Now we're going to look at why is it even important? Well, there's three reasons here. It's to ensure a more comprehensive approach with an emphasis on promotion, prevention, treatment, rehabilitation, care, and recovery. It also can avert danger to the consumer or others' health and well-being. Another reason why it's important is it also can reduce the need for expensive resources, such as emergency room visits and psychiatric hospitalizations. It also can prevent setbacks to a consumer's recovery that results from the aftermath of a crisis, such as a loss of confidence or self-esteem, a loss of a job, a loss of housing or placement, stress or burnout of family caregivers, damage to health of self or others. It also can help prevent brain damage resulting in repeated psychotic episodes or mental health crisis, and also various other setbacks. Another thing that you may not know is who should have access to an individual's crisis prevention and intervention plan. With the individual or guardian's permission, the crisis plan should be uploaded to a computer or a paper or electronic copy made available to all who need it in a crisis situation, like the consumer, the service provider, the MCO call center, and emergency room personnel. And don't forget the legal guardian and the family, the residential providers, law enforcement, the MCO staff, care coordinators, and others as needed to intervene in a crisis. Next, we're going to be talking about the essential values and principles. First, avoiding harm. Appropriate response establishes physical safety, but it also establishes the individual's psychological safety. Next is intervening in person-centered ways. Appropriate interventions seek to understand the individual and his or her unique circumstances and how that individual's personal preferences and goals can be maximally incorporated in the crisis response. Next, we have shared responsibility. This is an appropriate crisis response that assists the individual in regaining control by considering the individual as an active partner in, rather than a passive recipient of services. Addressing trauma. It is essential that once physical safety has been established, harm resulting from the crisis or crisis response is evaluated and addressed without delay by individuals qualified to diagnose the needed treatment. There is also a dual responsibility relating to the individual's relevant trauma, history, and vulnerabilities associated with particular interventions. Crisis responders should appropriately seek out and incorporate this information in their approaches, and individuals should take responsibility for making this crucial information available. Next is establishing feelings of personal safety. Assisting the individual in obtaining the subjective goal of personal safety requires an understanding of what is needed for that person to experience a sense of security, and this should be included in the crisis plan. And what interventions increase feelings of vulnerability, such as confidence in a room alone. Providing such assistance also required that staff be afforded time to gain an understanding of the individual's needs and the latitude to address these needs creatively. Also, we need to base things on strengths. An appropriate crisis response seeks to identify and reinforce the resources on which an individual can draw, not only to recover from the crisis event, but to also help protect against further occurrences. And we shouldn't limit to just one aspect. We need the whole person. The individual may have multiple needs, such as behavior and or medical, and an adequate understanding of the crisis means not only limited to one specific area. We need to address the whole needs of the child. We need to see the child as a credible source. How we do that is responding appropriately to the individual in the crisis and not be dismissive of the person as a credible source of information, whether it be factual or emotional. It is important to be understanding that they do have strengths and needs. And some of those needs might be their ability to recover, their resilience, or their natural supports. An appropriate crisis response contributes to the individual's large journey towards recovery and resilience and incorporates these core values. Appropriately, interventions should preserve dignity, foster a sense of hope, and promote engagement with formal systems and informal resources. And lastly, prevention. An appropriate crisis response works to ensure the crisis will not be recurrent by evaluation and considering factors that contribute to the current episode that will prevent further and future relapse. Next, we're moving on to the guiding principles. Those are the access to supports and service in timely manners. Services are provided in the least restrictive manner. Peer support is available. Adequate time is spent with the individual in crisis. Plans are strength-based. Emergency interventions consider the context of the individual's overall plan of service. and crisis services are provided by the individuals with appropriate training and demonstrable competence to evaluate and effectively intervene with the problems being presented. We need to show that the individual is in a self-defined crisis, are not turned away. Interveners have a comprehensive understanding of the crisis. Helping the individual to regain a sense of control is a priority. Services are congruent with the culture, gender, race, age, sexual orientation, health, literacy, and communication needs of the individual being served. We need to know that rights are respected, services are trauma-informed, recurring crisis signal problems in assessment or care, and meaningful measures are taken to reduce the likelihood of future emergencies. Now we're getting into how to complete the form. Step 1 to writing a crisis plan. Write the date of the initial crisis plan or the date of the last revision. And this is on the first page of the plan. Step 2 is write basic essential information about the individual, including the identity, date of birth, address or phone number, the MCO information, the living situation, the employment information, communication barriers such as language or preferences, legally responsible person, insurance information, the diagnosis. But don't include diagnosis number 5, as this may change in a crisis. Medications, including dosage, frequency, reason for change, date of prescription, and the prescribing pharmacy, and medical problems and allergies if needed. Step 3. Identify the support for the individual, and this is on the second page of the plan. This lists the individual that should be called in the event of a crisis. They indicate the calling order, provide contact information, and indicate if a consent release information to the person does exist. Step 4, crisis follow-up planning. And this is on the second page of the plan. Include which team member is the primary contact to coordinate care. Indicate who will be visiting the consumer in the hospital, and this should be under the consumer's preference. And indicate who will organize and lead a review debriefing following the resolution of the crisis and within what time frame this will happen. Step 5. Identify additional planning documents, and this is also on the second page of the plan. If it is indicated that the individual has any of the planning documents, attach the documents to the crisis plan. Step 6. Identify and write the general characteristics or preferences to include, and this is on page 3 of the plan. First, a description of what the individual is like when they are feeling well. Ask the individual what a good day looks like for them or her, and provide examples of how they feel when they have a sense of overall wellness and well-being. And then describe how they interact, appear, and behave. Then, a description of early signs that they are not doing well, including significant event that they may create increased stress and trigger the onset of a crisis. Make certain to include the consumer's perceptions of what caused them to be in crisis, such as the anniversaries or holidays, noise, change in routine, alcohol or drug use, non-compliance with medications or other medical problems, family conflict, and particular environmental stresses such as noise or maybe being isolated. Also, a description of the crisis prevention and intervention strategies that have been effective. Focus on prevention of the targeted behaviors. Focus on the least restrictive measure. Match the strategy to the behavior. Consider what occurs just before, during, and after the crisis, and be specific about relapse prevention strategies. A description of strategies for crisis response and stabilization describe ways that the individual can help themselves. Focus on the least restrictive measure. Consider the array of the available resources, backup support and crisis respite. Match the response to the level of behavior. Be sure to consider alternatives to hospitalization. Be sure to include special protocol to follow. Make certain the strategy reflects the consumer's preference for intervention. Include who should be notified of the crisis, the guardian or family, etc. Include a completion of incident report. Include a plan to coordinate regularly with the inpatient team. Consider and include provision of support while inpatient. And include development of discharge plans. Plan this ahead if it's possible. A description of acceptable and unacceptable treatment that have and have not worked in the past crisis, and specific recommendations for interacting with the person during a crisis. Describe preferred and non-preferred treatment facilities. Describe preferred and non-preferred medications. Describe how staff should interact with me when entering a crisis, including but not limited to listening to music, going for a walk, having a conversation, not having a conversation, peer counseling, being touched or not being touched, or etc. Collaboration and partnering efforts to ensure effective crisis prevention intervention. The advantages of partnering with service providers, schools, hospitals, emergency departments, management, law enforcement, general practitioners, medical clinics, and the list can goes on, is very, very important. The sharing of information and resources to improve the crisis delivery service system and to be more effective and efficient. We must provide first-hand knowledge about the individual and the current crisis situation, available crisis services, and how the services and or make appropriate referrals. We also need to assist in making appropriate referrals for individuals who need more support or a more specific support. Making that intervention process less stressful for everyone involved. We do this to clarify roles and to assist the individual and family in developing an extended support network. And lastly, to talk about final questions that you may ask yourself, you need to ask, when you're filling out the crisis plan, is there significant direction or guidance to be truly helpful to the person in crisis? Is the crisis plan truly an individualized plan that reflects the specific needs, preferences, strengths, and challenges of that particular consumer? You know, probably one of the biggest temptations in developing a crisis plan is to cut corners and develop cookie-cutter plans that are generic and not very specific. To be useful, a crisis plan needs to fit the individual needs of the child and their situation. And lastly, is the crisis plan up to date? In this time, people move, medications change, living situations and providers also change over time. Crisis plans need to be updated frequently so the information they contain remains relevant and useful. This concludes the Crisis Prevention and Intervention Plan training. Thank you very much for taking the time to check out this update, and I hope you have a wonderful day.